lot of research that's been going on over the past few years that's been trying to ask these questions via animal models and also via some clinical studies as well. And what the research seems to suggest is that if we look at the criteria that are used to define something as addictive, we're able to see that in animal models, animals will show many of those criteria. Those are things such as self-administration, escalation of dose, the development of tolerance, or having to consume more and more of a substance in order to feel that same euphoric effect. Also, signs of withdrawal, evidence of craving are also found in response to sugar, not necessarily just in response to known drugs of abuse. So while it's still a very young field, we are seeing more and more papers and more research coming out that is suggesting that there are overlaps, not only in the behaviors, but also in the changes in the brain that occur in response to eating sugars, and that's which is known to be seen with drugs of abuse. Well, in terms of the amount of dopamine release, the question is really about what is the magnitude of the release of dopamine that's seen in response to known drugs of abuse, like morphine or alcohol, and that is seen with foods. What the research is showing is that depending on the drug, you're going to see a different level of dopamine release, a different magnitude of release. Obviously, if you have a very high dose of cocaine, that's going to release a lot more dopamine, or you're going to have a greater level of dopamine in the synapse than you will with a maybe mild or moderate dose of alcohol. So different drugs and their doses will have different effects on the dopamine system. What we're seeing with many foods that are being overconsumed, like those that are rich in added sugars, is that in our animal models, if we give an animal a food that has a lot of sugar, those animals that overeat the sugar will show the same pattern of release that you would see in response to a mild dose of a drug of abuse. So normally when an animal eats a food, it does release dopamine, but dopamine in the case of food intake is more associated normally with the sort of novelty of the food, or the fact that a food might be the first time that the animal's been ever consuming it. And so remember, dopamine is associated with addiction, but dopamine also has a very important role in learning. And so when we try a food for the very first time, it makes sense that our brains are paying attention, if you will, because if we taste something and we've never experienced that taste before and we get sick from it, we want to make sure we remember that taste and we avoid it at all costs. So normally when we eat a food for the very first time, it releases dopamine, but after repeated exposures to that food, after it's been coded as safe, that dopamine release tends to attenuate. That's not like what we see with drugs. Every time a drug of abuse is administered, it releases dopamine in reward regions. And so what's interesting and what the new research is showing is that in many cases, when foods are overconsumed, or sugars, for instance, are overconsumed, the dopamine release is more like the pattern that you see with a drug, in the sense that every time the animals are self-administering sugar, it's releasing dopamine, which isn't what we would typically expect to see with a food. So how does naloxone, which is an opioid antagonist, cause opiate-like withdrawal in animals that are consuming sugar? This is a question that we've been able to ask empirically as well via experiments that have been done in the laboratory. Normally, if someone is addicted to an opiate and they're given naloxone, it'll block the opioid receptors and it will precipitate a withdrawal state. And this is a state that we can measure very easily via behavioral changes such as depression, anxiety. There's also somatic indications, changes in body temperature, changes in blood pressure, and so on. And so in our animal models, when we look at animals that are overeating sugar, it's interesting because if we administer those animals naloxone, they're not addicted to any drugs, they're not addicted to an opiate, so we wouldn't necessarily expect naloxone to have a measurable effect on behavior. But what we find is that if animals are over-consuming sugar, when we administer naloxone, it results in signs of opiate-like withdrawal. It's almost as if they're mildly addicted to morphine, but they've only been overeating sugar. And so we see signs of depression, signs of anxiety, somatic indications that are consistent with an opiate-like withdrawal state. We don't see this in animals that are eating a healthy diet, or even in animals who occasionally consume sugar. But in the animals that are excessively overeating it, we do see this evidence of opiate-like withdrawal emerging in response to naloxone administration. What are some lessons that a sugar or food addict might take from the work that's been going on in our lab? Well, there's a few different things. One is that it's important to understand that there's a biological basis to some of the overeating that is occurring. And so if someone is self-identifying as a food addict, if they feel that they're compelled to overeat certain types of foods, it's not all about willpower. It's not that it's their fault, that they don't have that restraint and that ability to control themselves. The research is showing that there's biological changes in the brain that can cause one to want to overeat, to want to engage in this repetitive overeating type behavior, that can really pull people into this addiction spiral that can lead to continuous overeating. So I think it's important to understand that there is a biological basis for this, and it's not necessarily just an issue of willpower. Another issue that I think is important to think about is the fact that there's a lot of research that's using psychological principles that have worked for trying to think about how we might treat addictions, like addictions to drugs. And so many of the things that have worked for drug addicts may also work for someone who self-identifies as being a food addict. So for instance, when someone's an alcoholic or has a problem with alcohol, we advise them to stay away from bars and to stay away from friends that like to drink a lot until they get their addiction under control. And the same may go for someone who has a problem with overeating certain types of foods or who feels that they're addicted to foods. You don't want to go to a restaurant that's your favorite restaurant where you always would indulge in a, 1,000 calorie dessert if you're trying to cut back on your sugar intake. So it's important to sort of think about these different practices and habits that we've created through our life and how that might be encouraging the addiction. And so the important thing is to identify those relationships and come up with ways in which we can mediate them. Now that doesn't mean you can never go out to a restaurant again, but it might just mean you want to break that habit of, if you always go to a certain restaurant and get a certain dessert, maybe try a different restaurant and start a whole new way of, having a tradition of when you go to that particular restaurant, the types of foods you get, so that you can break those associations and break those habits that have formed.